Knock, knock. Hello, my name is Morgan. I'm a student nurse with Southwest Tech. It looks like I have a doctor's order here today to administer your medication through your IV. Can you verify your name and date of birth for me?
Joseph Smith, 10553.
All right, and do you have any allergies?
Sulfa.
Okay, well, we're not going to be doing anything with sulfa. I'm going to check your wristband here. It looks good. Joe, first I'm just going to give you some information here about the medication we're going to be giving you today. We will be administering Rocephin, and the safe dose for that is 1 to 2 grams every 24 hours or a single dose over 30 minutes, which is what we will be doing today. And we use this for the treatment of serious lower respiratory tract, urinary tract, skin and structure, bone joint, and intra-abdominal infections. And you have pneumonia, so this drug will work great for that. We dilute this drug with each gram with 10 milliliters of solution, and then further with 50 to 100 milliliters. We have to be precautious about having any hypersensitivity. Some side effects might be diarrhea, dizziness, or hypersensitivity. And for diagnostic testing, we would check your BUN and creatinine levels. And the compatibility, we cannot mix this with calcium, so I'm just going to check here to make sure there's no calcium, which is not. And Joe, there is not an antidote for this, so if you experience any of the side effects that I told you about, make sure to let us know right away. Alright, so now I can do my first check with the MAR. I'm going to make sure here that I have my Rocephin, and that is 1 gram IV every 24 hours for pneumonia, and that looks good. I'm going to check the integrity of my packaging, and it has not been opened. The solution is not crystallized or discolored, and my tubing is intact. The packaging is not opened. That looks good. I'm going to check here, Joe, for any signs of phlebitis. I don't see any redness or tenderness. Does this hurt when I touch?
Nope.
Alright, and I'm not seeing any signs of infiltration either. It doesn't look like there's any pooling or coolness underneath the skin. That all looks very good. And here at Southwest Tech Hospital, we change the IVs every 96 hours, and this one is still good, so we don't need to worry about that. Now I am going to do my second check on the MAR. So I have the Rocephin, 1 gram IV every 24 hours, and this looks good. It is not expired. And I'm going to show here the math for how I'm going to calculate this today. So we would give this 100 milliliters over an hour, but it is only a 50 milliliter bag. And then, so that would, with our tubing, would equal 17 drops per minute. So 4 drops every 15 seconds. And so now I can go ahead and do my third check. I'm gonna put my gloves on here. So I still have my Rocephin, 1 gram, and that looks good for pneumonia. And I'm gonna state my 5 rights of medication here. So I have the right patient, the right medication, the right dose, the right time, and the right route. So all of that is good. So I can now begin to open up my supplies here. I'm just checking my tubing here to make sure that there's no holes, it's all intact. I'm gonna go ahead and shut my roller clamp right away. And I'm going to take my primary bag and I am going to hang that further down. I'm going to look and make sure that it is infusing, and it looks good. I can see it dripping in the drip chamber and the line looks like it's flowing good. So now I can go ahead and spike my medication. So very carefully here, I'm going to remove the cap. And making sure not to touch. Remove the cap of the spike. Alright. And so I'm going to go ahead and hang this here. And I'm just going to drape this over. I'm going to go ahead and clean the port on the primary infusion here for 30 seconds. Alright, and 30 seconds is up. And now very carefully again, I'm going to make sure not to contaminate. Alright. And so now I am going to open my roller clamp fully, making sure this is below the level of the primary bag. I'm going to prime my line here. Okay. And I'm going to shut this one and open this one again here. And I can now watch for my drip rate. Alright, so that is now calculated. I'm going to double check to make sure everything is flowing smoothly, and it appears that it is. Then I am now going to verbalize how I would remove the catheter. So I would wash my hands, apply gloves, and I would lay down a linen saver pad underneath just in case we spill any fluids. I would get a sterile 2x2 gauze and I would place it above the site of the catheter without applying pressure. I would remove all of the other dressings and tape, and then I would remove the catheter and with the flow of the vein, very gently. And then I would apply pressure with the gauze for 2 to 3 minutes. And then after the 2 to 3 minutes, I would discard of the soiled gauze and apply a new gauze in the new dressings. I would make sure to label my tubing before I would leave, and then I would document accordingly. Joe, do you need anything else from me?
No, I think I'm okay.
All right, see you later.